Welcome to EVA Medical Series. EVA Medical Series channel start working from March 2020 in the Malayalam language, the regional language of Kerala. From now onwards, videos are available in both English and Malayalam languages as per your choice. EVA Medical Series is aimed to bring a series of most authentic and relevant medical information. This medical YouTube channel covers a broad range of topics in the field of medical sciences. The material is professional and is mostly informative. Most of the videos uploaded here are targeted at medical students, healthcare professionals, and the common man, those who want to get straight fact quickly. It is a great learning resource for students and practicing healthcare professionals alike. Today, I am going to talk about Polycystic Ovary Syndrome, otherwise called PCOS. Polycystic Ovary Syndrome, otherwise called PCOS, is a condition in which the ovaries produces an abnormal amount of androgen, male sex hormones that are usually present in women in small amounts. In the Polycystic Ovary Syndrome having the numerous small fluid-filled sacs called cysts that form in the ovaries. However, some women with this disorder do not have cysts, while some women without the disorder to develop cysts. Polycystic ovary syndrome is common among women of reproductive age. Ovulation occurs when a mature egg is released from an ovary. This happens so it can be fertilized by a male sperm. If the egg is not fertilized, it is sent out of the body during your periods. In some cases, a woman doesn't make enough of the hormones needed to ovulate. When ovulation doesn't happen, the ovaries can develop many small cysts. These cysts make hormones called androgens. Women with PCOS often have high level of androgens. This can cause more problems with a woman's menstrual cycle, and it can cause many of the symptoms of PCOS. Women with PCOS may have infrequent or prolonged menstrual period or excess level of male hormone called androgen. Signs and symptoms of PCOS often develop around the time of the first menstrual period during the puberty, and sometimes it may develop later ages. The signs and symptoms of the PCOS may vary. Infrequent, irregular or prolonged menstrual cycle are the most common sign of PCOS. There may be missed periods or very light periods. Elevated level of male hormone androgen may result in physical signs such as hirsutism, a condition in which there is excess facial and body hair including chest, stomach, back, occasionally severe acne, oily skin, male pattern baldness or thinning of hair. Ovaries might be enlarged and contain follicles that surround the eggs. As a result, the ovaries might fail to function regularly, may cause infertility. There may be small piece of excess skin on the neck or armpit called skin tags. There may be dark or thick skin patches on the back of the neck, in the armpits and under the breast. PCOS signs and symptoms are typically more severe if you are obese. The diagnosis of PCOS is usually made when you experience at least two of the above said signs. The exact cause of PCOD is not clear. PCOS may also run in families. It's common for sisters or mother and daughter to have PCOS. Some factors that might play a role in PCOS, which include excess insulin, low-grade inflammation, heredity, and excess androgen. Many women with PCOS have insulin resistance. This means the body can't use insulin well. Insulin level build up in the body and may cause higher androgen levels. Insulin is the hormone produced in the pancreas that allows cells to use sugar, your body's primary energy supply. If your cells become resistant to the action of insulin, then your blood sugar level can rise and your body might produce more insulin. Excess insulin might increase androgen production, causing difficulty with ovulation. Obesity can also increase insulin levels and make PCOS symptoms worse. Some researchers have shown that women with PCOS have a type of low-grade inflammation that stimulates polycystic ovaries to produce androgens, which can lead to heart and blood vessels problems. And also, some research suggests that certain genes may be linked to PCOS. The ovaries produces abnormally high level of androgen, resulting in hirsutism and acne. There is a chance of some complications may occur in PCOS patients, which may include infertility, gestational diabetes, or pregnancy-induced high blood pressure, miscarriage or premature birth, non-alcoholic steatohepatitis, which is a severe liver inflammation caused by fat accumulation in the liver, metabolic syndrome, which is a cluster of conditions including high blood pressure, high blood sugar, and abnormal cholesterol or triglyceride levels that significantly increases your risk of cardiovascular diseases, type 2 diabetes or prediabetes, sleep apnea, which is a potentially serious sleep disorder in which breathing repeatedly stops and starts, depression, anxiety, and eating disorders, abnormal uterine bleeding, cancer of the uterine lining, otherwise called endometrial cancer. Obesity is associated with the PCOS and worsen complications of the disorder. There is no definite test to the diagnosis of PCOS. Your medical history, including your menstrual period and weight changes, and a physical exam checking for signs of excess hair growth, insulin resistance, and acne are considered for the conclusion. Then your doctor might then recommend a pelvic exam. The doctor visually and manually inspect your reproductive organs for masses, growth, or other abnormalities. Then recommend some blood tests. Your blood may be analyzed to measure hormone levels. This testing can be excluded possible cause of menstrual abnormalities or androgen excess that mimics PCOS. You might have additional blood testing to measure glucose tolerance and fasting cholesterol and triglyceride levels. Then your doctor recommends an ultrasound scan to check the appearance of your ovaries and the thickness of the lining of your uterus. If you have a diagnosis of PCOS, your doctor might recommend additional tests for complications. Those tests include periodic checks of blood pressure, glucose tolerance, and cholesterol and triglyceride levels, and screening for depression and anxiety, and screening for obstructive sleep apnea, etc. PCOS treatment focuses on managing your individual concerns such as infertility, hirsutism, acne, or obesity. Specific treatment might involve lifestyle changes or medications. If a doctor may recommend weight loss through a low-calorie diet combined with moderate excessive activities, even a moderate reduction in your weight might improve your condition. Losing weight may also increase the effectiveness of medications your doctor recommends for PCOS and can help with infertility. To regulate your menstrual cycle, your doctor might recommend combination birth control pills with estrogen and progestin, decrease androgen production and regulate estrogen. Regulating your hormones can lower your risk of endometrial cancer and correct abnormal bleedings, excess hair growth, and acne. Instead of pills, you might use a skin patch or vaginal ring that contain a combination of estrogen and progestin. Also recommend progestin therapy. Taking progestin for 10 to 14 days every 1 to 2 months can regulate your periods and protect against endometrial cancer. Progestin therapy doesn't improve androgen levels and won't prevent pregnancy. The progestin-only mini pill or progestin containing intrauterine devices is a better choice if you also wish to avoid pregnancy. To help you ovulate, your doctor might recommend certain medications. The oral anti-estrogen medications, clomiphene, is taken during the first part of your menstrual cycle. This breast cancer treatment medicine, letrozole, otherwise called Femara, can work to stimulate the ovaries. These oral medications for type 2 diabetes, metformin, improve insulin resistance and lowers insulin levels. If you don't become pregnant using clomiphene, your doctor might recommend adding metformin. If you have prediabetes, metformin can also slow the progression of the type 2 diabetes and help with weight loss. Gonadotropin hormone medications are given by injections. If you have excessive hair growth, your doctor might recommend certain medications to reduce the hair growth. Birth control pill decrease androgen production that can cause excessive hair growth. Spironolactone medication block the effects of androgen on the skin. Spironolactone can cause birth defects, so effective contraception is required while taking this medication. It is recommended if you are pregnant or planning to become pregnant. Eflornithine cream can slow facial hair growth in women. Sometimes electrolysis is also recommended. A tiny needle is inserted into each hair follicle. The needle emits a pulse of electric current to damage and eventually destroy the follicle. You might need multiple treatments. To help decrease the effects of PCOS, try to maintain a healthy weight. Weight loss can reduce insulin and androgen level and may restore ovulation. Ask your doctor about a weight control program and meet regularly with a dietitian for help to reaching weight loss goals. Limit carbohydrate. Low-fat, high-carbohydrate diet might increase insulin levels. Ask your doctor about low-carbohydrate diet. If you have PCOS, choose complex carbohydrates, which raises your blood sugar level more slowly. Be active. Exercise helps lower blood sugar levels. If you have PCOS, increasing your daily activity and participating in a regular exercise program may treat or even prevent insulin resistance and help you keep your weight under control and avoid developing diabetes. In the homeopathic system of medicine, there is a definite treatment for PCOS. Medicines like Calcarea carbonica, Folliculum, Lycopodium clavatum, Lachesis mutans, Sepia officinalis, Pulsatilla nigricans, etc. are the few medicines are used among the PCOS treatment in homeopathy. That's all about PCOS. New videos on various medical topics are released on this channel every Monday at 11 a.m. To regularly receive informative video like this one, subscribe to the EVA Medical Series channel and click on the bell button and turn on the all option. And don't forget to share and comment. Next week at the same time, on the same day, a new topic will come before you. Thank you.
Thanks for watching.
Like,
Comments
share,
and
subscribe.